A warm welcome to everyone. I am Kushi Halari from the final year of the physiotherapy. I welcome you all to my video. Today I am going to discuss about monitoring system in ICU. So let us start. Now ICU is intensive care unit. Intensive care unit has many systems for monitoring of the cardiopulmonary function of the patient itself in the ICU. Now the main goal for ICU is to maintain a proper oxygen transportation to a patient. Now there are many important systems available in the ICU. So let us start. The first one is ECG. ECG is electrocardiogram. Now there are two electrodes, positive and negative, and along with that there is a ground electrode. Positive electrode is present on the right side at fourth intercostal space, and negative electrode is present at first intercostal space. Ground electrode is placed at right side at subclavicular line on first intercostal space. Now the ECG have a monitoring display in which there is a continuous heart rate is shown, in which if there is any fluctuation in the heart rate, it will give a alarm sign. Now it is very much useful to track the tachycardia and bradycardia. Now second most important thing is fluid and electrolyte balance. Now fluid and electrolyte balance, if there is any disturbance in fluid intake and excretion, it will affect the patient health. If it is minor, it can be modified by the diet and fluid intake. But if it is major, there is major disturbance in the fluid intake or excretion, it can lead to a life-threatening condition. Now if there is any diarrhea or vomiting by the patient, it can lead to directly drainage of the fluid from the GI tract. As well, the same, if there is an hemorrhage, it will lead to loss of the electrolyte and fluid. If there is an increased amount of the fluid, it will directly elevate the blood pressure. So it is very important to maintain a fluid and electrolyte balance. Along with the normal level of the fluid and electrolyte balance, it is very important to maintain a normal pH in the blood. The normal pH is 7.35 to 7.45. If there is any alteration in the pH, it can lead to a life-threatening condition. The first system which is compensated by the pH imbalance is renal system, and next is pulmonary system. It can also lead to hypercapnia or hypocapnia. The third important thing is intracranial pressure. Intracranial pressure is monitored especially in the patient with head injury or any cerebral dysfunction. If there is an increased amount of the intracranial pressure, it can also affect the consciousness of the patient. Now the fourth important thing is electroencephalogram, which help us to detect the gross function of the cerebral. Now it helps us to detect the functioning of the cerebral and alteration in the arousal and consciousness. It is mostly used post-traumatic epilepsy. Now next is pulmonary artery catheter. It is have a reference of subclavian vein, interjugular vein, and peripheral arm vein. It helps us to detect an accurate measurement of hemodynamically condition of the patient. Now the next important thing is intravenous line. Intravenous line, it can be taken at any superficial vein through which we can insert an intravenous drug to maintain a normal electrolyte and fluid balance. So now fourth one is central venous pressure. Central venous pressure is very important because it helps us to detect the functioning of the right heart, also the vascular tone, venous return, and effectiveness of heart pumping. Now the veins which are taken as a reference is subclavian vein, basilic vein, jugular vein, and femoral vein. Thank you very much for your valuable time.